Welcome back. Still Daybreak Africa, features team originally here from our studios in Ondo City. I'm Ezekiel Ogar. At this morning, we shall be talking on Whitlow causes, prevention, and treatment. And with us in the house is Dr. Olubusayo Modupe, of course, our very old medical practitioner. He's the Director of Health Insurance Schemes State Specialist, Hospital Ondo, and Project Coordinator, HIV Program, State Specialist Hospital here in Ondo. Once again, welcome on Daybreak Africa.
Thank you very much. Good morning.
Good morning.
Good morning, Doctor.
Good morning.
Yes, so nice to have you once again. So, this topic is a topic that is very peculiar to me. A topic that I am very, very interested in. You know, a topic that somehow I get so scared of because I've seen people get affected by it, and I really do not know how it comes about. But eventually, in the process of my research, I got, should I say, more confused or more clarified. The reason why I had to, make it the topic for this morning so we can talk about it. So again, while I was talking to you about it, I was talking about hepatic Whitlow, then you were telling me was pyronychial. So you see the confusion just goes on and on. So I would want you to let us understand what we commonly call Whitlow on the street. Is it hepatic? Is it pyronychial, like you said?
Okay.
So let us understand.
Whitlow is different from pyronychia.
Okay.
They are two different diseases. Pyronychia affects the surrounding of the fingers, whereas
Hepatic.
Whitlow
Okay, Whitlow.
affects the tip, or we call it palmar aspect. Before you are confused, this is your palm.
You are
And so understand, this is the palm. So we just use it as the palmar aspect of the finger. So Whitlow, the medical Whitlow, will affect the tip. Yeah. The medical Whitlow is not very common. They are of two types. One caused by virus, herpes simplex 1 and 2, or the other one melanotic, that is early talk EPA. But the more commoner of affectation of the fingers is really the pyronychia that affects the surrounding of the fingers. There will be inflammation, that's swelling of that surrounding, which is caused either by trauma, irritation, or infection. Three possible:
Trauma, irritation, or
or
infection.
infection.
Can you break that down for us?
Yeah. When you talk about irritation, there are some people that walk where they always dip their fingers into water. Bartender, dishwasher. Yeah. There are some people walk with chemicals. That's their way of livelihood. Of course, those are irritants. You can have trauma. Simply what happens in pyronychia is this. You know this here, the base of the fingers. Yeah. That's the cortical. Then where the fingers enter the skin, that's the nail fold. Once there's a gap, And so that's why those who bite fingers, you know,
Uchu.
yes, chewed, or you know, once they have what's it called, something like tar coming out, if it's not quickly, in fact, most of the time you notice within days, pain will start.
Start troubling, like toothache.
That is paronychia. And then paronychia majorly is acute. Now within 6 weeks you get over it. But it can also be chronic. Those who have chronic are probably those who are perpetually in contact with irritants. That means the thing is always there. Of course, if there's a fungal infection tends to cause a chronic infection. Yeah.
So talking about Whitlow, how is it different from other types of herpes infections?
If it's herpetic Whitlow, herpes simplex can affect all parts of the body, from the genitalia. For example, that's what called genital herpes. It is a sexually transmitted infection. But this one, the only difference is that it's now herpetic Whitlow. The infection is air, and there's also vesicles. Vesicle just mean swelling. You notice a swelling containing clear fluid. That's what happens.
So, like the question Ezekiel just asked now, I would really want, like the HSV that you mentioned now, I was surprised that people can have it in their body and not even know that they have it. They become asymptomatic. They don't, it doesn't, show. They don't have any symptoms of it. And I discovered too that it can be transmitted from person to person. Then in relation to what we're talking about, I also discovered that there too, like you rightly said, I would want you to let us understand how this HSV could actually lead to this infection that we're talking about.
Once it gets access to the, what's it called, to the fingers,
The injury.
One can have herpetic Whitlow.
So I don't know if you can tell us more about the causes of Whitlow. What can, apart from the three that you've told us, are there other ways that people can come down with Whitlow?
That would now be more of risk factors.
Okay.
More of risk factors.
So let's talk more about the risk, because you told us three. It could be traumatic, it could be...
It could be through infection, and it could be through irritation.
Okay.
Other risk factors. In fact, there are some drugs, antiretroviral drugs, that can predispose. Sucking of
the tongue.
That's why herpetic is not common. That is now in children. That's now in children. Of course, those who male bite, they are all risk factor. Low immunity is a risk factor. Either acquire or because you have some diseases that's reduced the immunity, or probably you have some other drugs that is reducing the immunity. So these are common risk factors. Yeah.
So how common is Whitlow among health workers and general population? I
told you, if it's herpetic Whitlow, it's 2 in 100,000.
200,000.
Yeah, so it's not common. But paronychia is commoner because we get involved regularly. Some people, what's it called? They wash clothes, they wash dishes, it's commoner. That's one. Then number two, because a lot of us of our habits, you notice even elderly people will use their teeth to cut their fingers. Have you seen it before?
Mm-hmm.
These are simple risk factors. That's why the paronychia is commoner than Whitlow. Unfortunately, the environment we call paronychia Whitlow. So when you have that, they will tell you have Whitlow. But when you get to the hospital, the doctor's diagnosis is paronychia.
So when you talk about diagnosis, how do you differentiate between what is paronychial, what is hepatic, or how do you differentiate it? How do you tell the patient that this is exactly what is presented?
Yeah, by the time the presentation is so simple, it's straightforward. One affects the surrounding of the finger, the other one affects the tip of the palmar surface with vesicles. It's straightforward, but it's the patient that don't know the difference that cause paronychia Whitlow. Just like you people.
We are mixing up because we're not professionals.
Yeah.
So in the course of doing this investigation, what I really focused on, or what I discovered, because again, it's become obvious that there is a need for us to understand the difference in what is Whitlow, what is paronychial, what is hepatic, and all whatnot. And I've had that confusion for a very long time. And I remember then when my siblings had it, the common treatment, though we're not talking treatment now, the common treatment is you put palm oil to the arm is like when you blow a balloon, it gets so swollen, and at night there's so much pain. I just want you to let us know that what are the symptoms basically when one comes down with this.
Okay. When you have paronychia, which everybody calls Whitlow, depending on the fingers affected. When I was introduced, I said inflammation. What do you see in inflammation? One, there is pain. The thing is swollen. That's typical sign of inflammation, pain. The place is swollen. It will be red. When you see that, of course, if you touch, we call it tenderness. It's very tender. That's what you see.
Does it come with fever? Does it come with nausea? Does it come with headache? Does it come with what other symptoms?
Now, if it's paronychia, because it's local, it will not. But if you are thinking hepatic Whitlow, which affects the tip here, because the virus can be systemic, there can be other symptoms of systemic infection, from fever, general body ache, that way, in hepatic Whitlow.
So how can it be transmitted?
If it's paronychia, which we popularly call Whitlow, will not be transmitted. But hepatic Whitlow, because it's caused by a virus, can be transmitted, especially when there is vesicles.
What do you mean by vesicles?
Vesicles, I've explained. There's a swelling at the base of that skin lesion. You now notice that it's containing clear fluid. That is vesicle. At this time, they are very contagious. And any of the herpes infection, when you have, I don't know what they call it, herpes labialis.
Most people have it when they have malaria.
No, it's a sign of herpes infection. It's not everybody that has it. But when you have an infected process, your immunity is low. That's why it's coming out. It's herpes labialis. It means you have herpes infection.
Doctor, please help me understand. I know certain people, I just want you to explain. I know certain people who will say, oh, they have malaria and they have
That's not a sign of malaria. It's herpes labialis.
So is the herpes that is causing the fever for the people?
No. When you have malaria, at that time, probably your immunity dropped. Are you getting me? And so when that drops, there is reactivation of the herpes infection you have. Labialis. It occurs in the...
Is it hereditary?
No, it says you don't get, you are not born with that. You are not. But if you have herpes infection, of course you can have herpes. So that's why not everybody have malaria and have that.
This is education today. So please, still talking about this HSV, you did tell us that we have two types, the type 1 and the type 2. Can you please help us understand?
There is type 1. Even I will not be able to recognize it. It's the lab that will differentiate it. But we know that one causes more of the herpetic Whitlow, like 60%.
Okay. Let us understand sores in the finger, because a lot of people actually think when they have sores on their finger, it automatically, especially when it happens on the edges. Yeah. I just want to know if all the sores that one has at the edge of the finger will turn to a Whitlow, or the moment one sees the sore on the finger is already a Whitlow.
Well, if you have sore, it's not
at the edge, and it's throbbing, it's painful.
No. If there's a sore there, you already have something that would predispose to paronychia. I won't call it Whitlow.
Okay.
To paronychia, which people call Whitlow.
Whitlow. Okay.
Of course, infection will get into it. You know, this our skin, when it's intact, it's protecting us a lot. Once there's a cut, then you allow microorganisms to get inside. And once because there is a sore, of course, microorganisms will get inside. And because it's affecting the surrounding, then it will develop into Whitlow. But that you have a wound. That's why I was trying to say, you know, when you there are times you notice some tag.
Yes. I usually have tag.
Yes.
Even in this old age.
If you don't quickly cut it, you notice you start to have pain.
Yes, throbbing.
And so by cutting it, you are limiting further access of any infectious agent. You notice almost immediately it stops. But if it continues, very soon you notice that everywhere becomes swollen, painful. The description of the pain is throbbing, red. Then that person has developed paronychia, which you people call Whitlow.
I really tend to wonder, healthcare workers, how best could they prevent Whitlow? Because I know they are more like in the forefront when it comes to Whitlow treatment and all that.
Again, herpetic Whitlow, of course, can infect health worker if they don't practice what we call universal precaution.
Putting on gloves?
Yes.
Okay.
That's universal precaution.
I got that one right.
Yes. Hand washing is, you understand?
Yeah.
We want to, it's universal. Because the principle of universal precaution is you assume that everybody you are seeing every patient coming to you is potentially infectious. So protect yourself.
As a medical practitioner.
Yes. That is principle of universal precaution. And so, if it's herpetic Whitlow, you are at risk. But if it is, what's it called? Paronychia, which people call Whitlow, then not really.
Now, talking about hepatic Whitlow, which we've already identified may be caused by or is caused by the HSV virus. I just want to find out if once someone has hepatic Whitlow, if it is treated, does it go permanently, or is it possible for you to recur again? And why would it do
because
that?
In the first place, that virus, I told you, that's why some people keep having herpes labialis.
Every time they have malaria, they present
yes.
with malaria.
Yes. And so if you expose
once to
yourself,
it,
are you getting my to the same thing that caused the initial episode? You are going to have it again.
so once someone has that virus in their system,
Yes,
it's going to be there forever, or is it possible to one day come out of it?
I think that's difficult.
Whoa, that's serious. So, so we've talked about symptoms. I don't know if we can talk about maybe treatment. Should we talk about treatment, or should we go into treatment? Or there's another question I want to ask, the complications that come with it before we can actually go to treatment. I want to talk about complications that come with either hepatic or the other one that you talked about before one can actually say, oh, I think it's high time I see a doctor.
Herpetic Whitlow, because it's viral, of course, can become systemic, can get into the brain, can affect all parts of the body.
Wow.
That's herpetic Whitlow. For paronychia, it's more localized, commoner, and of course that can majorly develop into an abscess. Yes.
What about hand hygiene? Is it really effective when it comes to preventing Whitlow, or it just does the usual minimal?
I just say universal precaution. Yeah.
Basically.
Okay.
All right then.
So abscess is another word that a lot of us don't understand how it comes about. I've seen people go take injection and develop abscess. Is a word that we hear and a lot of people don't know about. Do we compare abscess with Whitlow, or is there a difference between abscess and Whitlow?
Again, I talk about paronychia, not Whitlow.
Okay.
What is abscess? It's collection of pus. So when that throbbing is much, there's likely to have already been pus formation. So it's already an abscess. And to treat abscess, you need to get the pus out. So now, it's not all paronychia that they put they do R&D, that's cutting. But there's some, you even notice that the thing is swollen, you feel, and when you press it, it will be, we call it fluncus, it will be coming in, that means there's pus. And where there is pus, anywhere there is pus in the body, you must go there and get it out. Without that, there can be no peace.
So that is abscess. Okay, still talking about hepatic hepatic Whitlow. I just want to know why it is important not to touch the eye. because you've told us now that if hepatic Whitlow is not treated, it can spread to the brain, it can spread to other parts of the body, and I've never heard that before, and it's so scary. And I just want to, before we go on our break, I just want you to help understand why it is important that people who actually know they have hepatic Whitlow should avoid touching their face or wearing contact lenses or things like that.
It's so simple, because it is hepatic, that's caused by herpes virus. It's highly contagious, it's highly infected. And if you already infected hand and you are using it to touch, notice under this, there's nothing covering it. So if you do like this, you are already technically, you are the one doing the direct infection of your eye. Because this finger is already infected and you are using that finger to infect the eye. So it's just like direct inoculation.
So the eyes get infected, and that's another problem entirely. Okay.
And unfortunately, you have contact lens in, and if it gets involved, then you can eventually become blind.
Wow, that's serious. Okay. If you just joined us, we're talking health this morning on Daybreak Africa. Now, try and understand this. This particular topic is a topic that's been so confusing. The reason why we are just dragging the doctor back and forth. I really want to understand every aspect of this topic, and I'm beginning to see the light of it. All right. So if you started with us and you've had that confusion, then you need to sit back so we can conclude on the discussion in the studio this morning. So this is the point where we take our break to go for tea. We'll be right back. Yes, welcome back to Daybreak Africa. Dr. Modupe is still here as we take a look at the different types of Whitlow. Of course, we've learned that there's hepatic, there's something we call Whitlow that is not Whitlow, is something else, and the doctor has been helping us understand that. Before we went on the break, the doctor was talking about the fact that if you have hepatic Whitlow, it is advisable you don't touch your face or your eye, or if you use contact lens, you shouldn't use at that time, but it's possible that you can get your eyes infected, which can eventually lead to blindness. So as we return, we want to talk about, I don't know if we're done with the complications, or you want to tell us more complications that may predispose to going to see the doctor. So at this point, when is it, I don't know if Ezekiel has, before we go to treatment, you have a question you want to ask the doctor?
Actually, I was wondering how often Whitlow could occur and what triggers it. You did mention excess washing.
Yes,
with water.
Paronychia, irritation.
So how often could one get it? Is it a one-time thing?
No, you can, once days, yes, as much as possible, you know, take precautions.
Okay, so I want us to go to treatment. I just want us to go to treatment. So, or should I say test? Is there some form of test that will be carried out before treatment?
For paronychia and even hepatic Whitlow, majorly, is clinical diagnosis. It's clinical diagnosis. Very rarely will you probably ask for some other tests to be more specific, to know what is causing it, because most of the time it is clinical. What we mean by clinical diagnosis, once you see it, you know this.
It is this or that.
This. Yeah, that's what we mean by diagnosis.
So at what point do you now need to do a swab or a blood test to actually determine what it is?
If, for example, you are thinking in paronychia, If you want to be now more specific of the causative organism, you may take a wound swab for microscopic culture and sensitivity. This will tell you exactly what is the bacterial agent causing it and which particular antibiotics will work best for it. But because we are also aware of the commonest microorganism causing it, for example, for paronychia that we call Whitlow, is caused by Staphylococcus aureus commonly. You are surprised. You are Staphylococcus aureus. You know, I always smile when the traditional doctor,
when you are at the park, traveling,
everybody as if staphylococcus has a lot to do with infertility. I'm surprised. Staphylococcus, no. You know, the boil, the common boil that we have is caused by Staphylococcus aureus. So I'm surprised with, but let's just
maybe because of the name, the way it sounds. It sounds big.
Are you getting my point? So
we demand attention.
The commonest is Staphylococcus aureus. Then of course we can have Streptococcus pyogenes. So we have an idea. So even without doing the tests, we are most likely going to give you antibiotics that covers
the spectrum,
a broad spectrum, putting the likely causative organism into mind. At times, if it's prolonged, you may want to do an X-ray to confirm the bones are not affected.
The bones?
Yes.
I thought it just happens to the flesh.
No. You know, any infection that is prolonged, because even paronychia can be acute or chronic. Acute within 6 weeks, everything is gone. But if it's still on after 6 weeks, there is chronic. You know, if there's an injury, anything, look at the fingers. How many muscles? This finger, how many muscles is it? Can we measure the muscle here? It's very small. It's very small. Can you compare the muscle here? Are you getting my point? So that means anything affecting the skin can quickly get into the bones, unlike hair. So especially when it's not responding, then you may have to have an X-ray. Has the infection gotten to the bone? Is there osteomyelitis? That's infection of the bone. Then because the treatment will change. If the bone is involved, we're going to use stronger antibiotics, something that will penetrate into the bone, of course, longer.
So you're talking about acute and chronic.
Paronychia.
No, the acute and chronic is not the same.
Acute is different from chronic.
Can you please tell us the difference in this particular situation?
In medicine, acute and chronic. When you say something acute does not mean severity. No. We tend to think that acute
and chronic, because that's the general English that we understand
acute, it's not long lasting, where chronic is long lasting. So somebody that has been sick, for example, 6 months, 7 months, that's a chronic
situation,
illness. So and they want to make an advert, they will say that's a chronic illness. But somebody sick within a month, that is an acute illness.
So what can predispose? Yes.
So when I talk about acute, I'm talking that within 6 weeks, this is clear, that is acute. If it's prolonged, more than 6 weeks, then it's
That's chronic. So in this case, what can predispose to between chronic and acute? What conditions can lead to it?
If it's infection, skin infection, it's likely going to be acute. But if it's due to chemical, because you keep doing your work
Every day.
If it's exposure to water, you must, if you're a dishwasher, that's your job, you must do it all the time. Then if it's not a bacterial infection, and if it's a fungal infection, then it's going to be chronic. And so again, if, for example, after 6 weeks, the treatment appears not to be working, then we now know this is chronic. We now again examine
to find out.
So what then are the potential complications for untreated or severe Whitlow?
Chronic.
Oh, chronic.
No, if it's chronic paronychia, there can be abscess. 1, 2. Of course, the pain is not resolving. At a time, there can officially be loss of function because you won't be able to do what you are supposed to do again. Those are simple things that I can offer.
So more like antibiotics can actually help with all that, or is there a particular drug prescribed for issues as this, or it has to be, you have to go to your doctor, it has to be accessed before understanding what should be.
Now, if there is paronychia, well, because again, the commoner is a paronychia that you people call
Whitlow.
Because most of the time, you just notice in days, you just notice the pain, swelling. Really? If one, quickly at the beginning, you can do some self-home stuff. Getting that fingers into warm water, like 3 to 4 times
a day.
In a day, for like 2-3 days, there should be
relief.
relief.
Should one put salt into it?
Not necessary.
Okay.
Just warm. And that's why traditionally, I'm a Yoruba man, you put it into, they'll say you put it into hot morsel of eba. Are you getting my point? You know it's, you just put it.
And bear it.
Are you getting my, because the really is that, so it's the traditional as if you are fermenting. That's what it looks like. But again, if in 2-3 days
there's no improvement, see your doctor.
Then you need to see your doctor. I think you will need a pain relief and most likely antibiotics.
Wow.
So let's talk about the treatment now. Before we talk about how to actually take care of wounds or sores or lesions that happen to the finger, because you told us now that the skin protects humans, and the moment there's a breach, there is an injury, it opens to a lot of complications if not properly treated. We've identified that the skin is like a protection to humans. That's why when you talked about skin bleaching, you told us about what will happen when the melanin is eroded, that even that too can predispose to a lot of medical complications. So let us now talk about...
You know what happens in burns? When there's a burn.
Yeah.
When somebody has a burn.
burn.
The covering is removed. That's why it's so dangerous. We treat every burn, no matter how small, as emergency. Because what is covering, what is protecting you
It's exposed.
It's exposed. So that's why burns is like an emergency, especially when the surface is much. Because the support, the protection is
gone. Okay. So what type of treatment, first medically, before we go back again to the traditional or home remedy that one can have? I don't know if you can help us understand when the test has been done or the person has been evaluated and the doctor now knows this is what the person has. What type of treatment do you recommend for all that you've mentioned today?
Okay, let me put it, finger infections. Either the paronychia, which is popularly called Whitlow, or the herpetic Whitlow. The first thing is pain relief. They are in serious pain. They need something to relieve the pain. True. If it's paronychia, that is popularly called Whitlow, because the commonest causative agent is infection, then you give antibiotics, which I said will be broad spectrum, thinking of the common causative agents. But if it's herpetic Whitlow, because it's virus, you are going to use antiviral. Acyclovir is the commonest in this environment. Sorry, let me just pause, because as I mentioned that drug, you know, there's a popular disease that you notice there's just a rash on a line in the body. You have not seen it before. It's also herpes.
What's the name of the disease?
Someone wakes up and sees a
rash on a line. It does not cross the midline. It's only on the side. It's also caused by herpes. No, that's why herpes is big. Herpes is big. Immediately I mentioned the popular antiviral, because that's what, that one is common. Common, because it's even after it has healed, the person will probably still come severally because of pain, because it affects nerves on that side. That's just by design. Just again talking about herpes, it's common. A lot of us. So herpes affecting the fingers is the least common of all herpes infection.
Okay.
But herpes as an infection is very
common.
Big. Yeah.
Big. Okay.
Yeah, so I talked about antiviral. Then again, probably the most important thing, because you must also have an idea, why are you at risk? If, for example, you touch a lot of irritants that keeps leading you to the same symptom, having paronychia, then that means when you do your work, you must wear gloves. It's not only, there are not hospital gloves. There are some other gloves that you can wear to years. Because of that, you wear that. If you are diabetic, because diabetics, they are also at risk. They have low immunity, little thing. They have what we call lazy leukocyte syndrome. Again, if you control your sugar properly, then you will not likely have. But
sorry, talking about the treatment, you only spoke about the painkillers. You didn't tell us any other thing.
I talked about specific. If it's paronychia, you use antibiotics.
Okay, so that's
If
just
it's-
it.
Yes. If it is herpetic Whitlow, then you use antiviral. That's what I said.
So and
Because that's specific, you are going to what is causing it.
okay, now you've told us two things now, or I've discovered two things.
Yeah.
If someone has Whitlow, either this or that, is supposed to last for
the common
the
Whitlow
common Whitlow
is paronychia.
paronychia.
Yes.
It's supposed to by 2 weeks, 3 weeks, the person should be
Because
okay.
it's acute, you'll be okay. You can't even stay. If you have paronychia, you can't even stay a week. If you have experienced it, if you're a witch, you will confess because of the pain. I am telling
Or if
you.
you are not, you can say yes, just to get well.
And you know again, because I was talking about, there's no much tissue here. And so anything that gets inside
It's
and it
intense.
is swelling, it will cause a lot of
It's
pain.
intense.
Unlike if you have infection here, before you really feel the pain, the muscle is massive, but there's nothing here. So that's why the pain and the thing, because of the swelling, unfortunately, there's nowhere to swell to again. And so that's why they have so much pain. And of course, if nothing is done, there will be pus collection, making things worse. That person will not be able to sleep. The next day, the person will be the first person in the hospital, any hospital.
So when you talk about pus collection, would one need to incise
Once there's pus,
to remove the
yes, I
pus,
said
or
that
would the
earlier.
drug just dry it up?
Once there's pus, anywhere in the body, the pus must be evacuated. So they need to incise. What happened? You're afraid?
No, I'm trying
He's reacting to it.
trying to pay more attention at this point. Now, I know when it comes to vaccine, we always tend to ask people abroad for help when it comes to vaccine. I don't know if is there vaccine for this first? And if we do have it?
No, for herpes, I think there are some vaccines. Yeah.
Some.
Yeah. But again,
Very common, or of course the usual route.
Not common.
So to prevent, let's talk about prevention. How do we now prevent getting herpes or getting the other one? How do we prevent coming down with what we commonly call Whitlow? What are the preventions?
We've talked about the possible causes.
Yes.
And so that's what we guide against. Simple.
Is there any
No
additional?
No nail biting.
Mm-hmm.
For herpes Whitlow, because it's the kids that suck thumb, no thumb sucking. Don't turn your teeth
To blades.
to blade. And of course, if you notice any injury on the fingers, quickly treat it.
Can like a rusty, or some people use rusty blades to cut, can that too lead to it? Old blades, people use because it's so expensive now.
No.
You use and you
Easy.
keep on the shelf.
Cutting the what's it called? The nails. Of course, it's not hygienic. It's not right to even use rusty.
Old.
Yes, it's not right. You don't even know who have used it. You don't know. Of course, if it's rusty, there are infective agents on it. Even the new one that you just tore. If it's just like if your eyes of science is open, if we can see with our eyes, just like microscope, probably we will open your mouth
To
again
talk.
because as we are here,
There are germs everywhere.
germs everywhere.
Okay.
Talk less, something dirty, of course. So it's not even right.
So as a roundup, doctor,
Yeah.
what advice do you have for people on how to treat wounds, or especially wounds that happen on the finger, as a roundup?
All wounds should be properly treated. There are some simple things naturally we do. A lot of people will apply iodine standard. But any wound you notice is not responding, please go to the hospital.
Okay.
To what you are doing, go to the hospital.
Okay.
It can be more than you think.
All right, that is all time will allow us to go on this very, very important topic this morning. We want to appreciate Dr. Modupe for being on the show once again, and hope to see him another day, another morning on Daybreak Africa.
It will bring us to end for Daybreak Africa for the morning. But of course, we'll be here same time, same station tomorrow. You do have a wonderful day ahead. I remain Ezekiel, Ogar.
That's the show for this morning for me also. And with Binitie signing out, saying, stay healthy. Bye for now.
Yes, there is news on your device, but hearing an analyst's perspective is the icing on the cake that Daybreak Africa provides. Start your day with prompt analysis of the latest news, trends,
Exactly, and then you see these people, they're so agile, they can do a lot of
politics,
We have to go back to that regional system. That is the foundation of this country, for God's sake.
entertainment, fashion, culinary skills,
So first I'm going to be pouring the oil inside the pot, and I will...
religious and cultural events, amongst others, on Daybreak Africa.
For a rich mix of analysis on current issues, tune in daily from 7 a.m. to 9 a.m. on channel 480 and 124 on Startimes.